The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White, and we're very glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Kim Thorne Motors, and of course our technical producer, J.D. DeAngelis. This morning in the studio with me is Brad White, a compounding pharmacist, and our very special guest, Sarah Schemmel, RN and manager of the Mercy Haven program. Thank you for joining us this morning. Welcome to the show.
Thank you for having me.
Sexual violence affects millions of Americans, both men and women. According to RAINN, the nation's largest anti-sexual violence organization, every 98 seconds someone is sexually assaulted. The assault can take many different forms, but one thing remains the same: it's not ever the victim's fault. Today we're going to talk about treatment and resources that are available locally for our victims. I'd like to remind our listeners today that this program is also available on our podcast, which can be downloaded from the App Store for your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions during today's program, we invite you to post them up live on our Facebook feed, or you can give us a call at 330-450-1480.
So, Sarah, tell us a little bit about yourself and what you do at Mercy.
Well, I am the manager of the Haven program at Mercy Medical Center. I came to Mercy in 2008 as emergency department nurse and recently transitioned into this role due to a passion in serving underserved populations and patients who have been victimized.
So, how prevalent?
Well, as you recently just said, according to RAINN, a sexual assault occurs every 2 minutes. What's important to know is it can impact anyone, anytime, regardless of age, gender, race, or socioeconomic status. It does not discriminate.
So, is it true that many sexual assault victims really know the attackers? And can you go more into depth with the statistics and why that might be? And are they generally relatives or friends or neighbors or...
Yes, that is true. The majority of sexual assaults are perpetrated by someone that the victim knows. With childhood sexual abuse, the offenders tend to be individuals that often have close access to the child, such as a relative, a neighbor, a friend of the family, someone that you trust. With adolescents and adults, we frequently see violence perpetrated by other students, by current or former dating partners, or by individuals that the survivor identifies as a friend or acquaintance. Sexual assault perpetrated by strangers does happen. However, when we look at the big picture, sexual violence occurs more frequently by people we know, someone known to us.
So tell me what HAVEN stands for.
HAVEN stands for Healing After Violent Encounters Network.
I was listening to the news not 5 minutes ago, and that situation at the school in so it was Maryland with the shooting. Was a sort of a boyfriend-girlfriend thing that don't know what happened, obviously, but it's kind of caught my thoughts because of what we're going to talk about today.
Yeah, I didn't have a chance this morning to take a look at the news or see anything regarding that today. So,
okay, Mercy has had a SANE sexual assault nurse examiner program prior to HAVEN. In fact, Mercy had the very first sexual assault program in the area. Is that correct? And can you tell us how and when this got started?
Yes, Mercy, our mission is always to meet those needs in our community. Early on, we recognized that there was a need for specialized care for survivors of sexual violence, and we responded by building the Stark County's first sexual assault nurse examiner program in 1999. This program offered the medical forensic exams and evidence collection to survivors and facilitated connection to community-based rape crisis programs for emotional support and aftercare.
So, in 2016, Mercy's sexual assault program was able to really expand its offering. Can you tell us what the expansion involves?
Yes, due to the VOCA grant, from the Attorney General's office, we were blessed to be able to now respond to additional types of victimization, those including human trafficking, domestic violence or intimate partner violence, as well as elder abuse. So our response is no longer dependent on whether or not you have that sexual assault evidence collected. We can now respond to any type of violence regardless of what the patient wishes to have done.
So this is in the hospital or in one of the buildings around it?
Yes, we are based out of Mercy Medical Center's main campus. We can respond to the emergency department or with any department within Mercy Medical Center main campus.
Okay.
Given the high-profile attention that many high-profile actor and actresses have been given lately due to sexual assault allegations, have you seen incidents for sexual assault in our community on the rise? Has it been about the same? What do you see?
Well, when looking at our program statistics from this year to last year, we've seen about a 50% increase. I would like to say that's because we're active in the community and reaching out, and people know services are available. So I think that the more awareness that is going on in education in our community, people have a voice and know that they can come and get help. Sexual assault, I think, has always been there. I don't know that the numbers are rising. I think that with awareness and support and options and changing the culture within our society to avoid victim blaming, people feel they can come forward and get help.
It's got to be a very difficult thing to get people to come forward, especially if they're worried about consequences or what other people are going to think. So I assume that there's support for those victims in that regard also?
Yes. So I think one of the most important things that Haven does is we support that patient's right to choose. They do have options available to them, meeting patients where they're at, and what needs they identify is key in performing patient-centered care, as well as really trauma-informed care, working to not re-victimize that patient. We do work with area collaborators to provide advocacy on site for domestic violence patients. We partner with Domestic Violence Project to respond to our hospital to provide that support and community options. And for our sexual assault patients, we partner with Compass Rape Crisis here in Stark County to provide that on site at our hospital as well.
Are there other services Haven provides to set these type of services apart that Mercy offers?
Yes, we provide a lot of specialized services to our patients, specifically that medical forensic care by trauma-informed staff. We offer a la carte services, meaning that patient has the option of choosing all the services, none, 1, 2, in whatever manner that they wish to choose. We provide supportive services such as crisis intervention, safety planning, service connection to community resources in our area, information about crime victims' rights, the criminal justice process, and reporting options. We also provide information with assistance of victims of crime compensation, getting medications paid for, helping with financial assistance, and we are a safe-at-home provider for the state of Ohio as well.
What does that mean, a safe-at-home provider?
A safe-at-home provider is a state address confidentiality program, so patients can register to have their address not be public.
Okay. I don't want to go off topic, but I'm thinking, given the subject you're speaking of, is this where, and I don't know if this is the PC term still, so forgive me if it's not, or educate me if it isn't, but do you work hand in hand with a battered women's clinic in the area where people go to get help to get away from the problems they have, but in that confidential environment they get some medical care, but maybe some counseling? Is Haven involved in something like that also, or is this kind of different programs?
Yes. So Haven does respond anywhere in the hospital. We provide that initial medical care. There's not really a clinic specific to domestic violence, but we do work with our Domestic Violence Project. They provide advocacy, legal advocacy, support, options to patients, as well as shelter, transitional housing. They do a lot for our community. So we partner with them for that continuum of care. We meet that immediate medical need in the hospital setting.
Okay. So I can only imagine that, much like your extensive nurses training, there must be a lot of extra training to become a Haven nurse. What kind of training have you gone through to help these patients in their time of need?
Yes, so the first step is you have to be a registered nurse. All of our Haven nurses are SANE trained by the IFN, which is the International Association of Forensic Nurses. They receive a 40-hour training in providing comprehensive physical and emotional care of the sexual assault patient. This includes the evidence collection process and testifying effectively in court. In addition to this training, our SANEs undergo a lot of training, focused training in the areas of photo documentation, in the areas of trauma-informed care, and specific non-fatal strangulation assessments, and training inclusive of other types of victimization, your human trafficking, intimate partner violence, and elder abuse. All our nurses complete a 4-day clinical training using a live patient simulation, and we also require our nurses to be ACLS, which is Advanced Cardiac Life Support, and TNCC, which is Trauma Nurse Core Classes Certified.
So Haven's a national name, or it's your name?
Haven is specific to Mercy Medical Center.
Okay.
It sounds to me like you're part nurse, part CSI investigator in a way. Is that a loose analogy, or?
Yes, that would be a very loose analogy. It's not typically what you think of when you see on TV. So that is Hollywood version. Being a SANE nurse, we do have components where we're collecting evidence and doing the evidence collection kit, photo documentation, taking biological specimens. But once again, that's solely dependent on that patient's wishes. So you can have a SANE nurse and have that done, or you can have none of that done. It's really up to the patient. It's more about meeting patients where they're at, providing that medical care, support, and options to the patient.
Tell you what, we'll take our first break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White from the Medicine Center Pharmacies. If you had chickenpox, you are at risk for shingles. Shingrix, the new vaccine for shingles, is now in our pharmacies. Did you already get the other shot? Shingrix is more effective, and you will need to get a 2-shot regimen. Talk to your Medicine Center pharmacist and learn more about this new injection. The Medicine Center pharmacies at Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. See us on medshoprx.com. We keep hearing on the radio that the big chain pharmacies have all kinds of zero copays on Medicare Part D programs, as do we. But our pharmacists using iMedicare software have saved Part D patients lots of dollars by helping select the right Medicare Part D plan during open enrollment. Not all Part D programs cover the same drugs. Our pharmacists make sure that the Medicare Part D enrollees see all the available programs that are the best for them. The Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, 13 pharmacists to serve you. See us on MedShopRx.com. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about the Mercy Haven program with registered nurse and program manager Sarah Schemmel. Have a question, give us a call at 330-450-1480 or post your question on our live Facebook feed.
Sarah, before I hit you up about the process at the ER, could you just educate our listeners just joining us about what Haven stands for and what the program is about for Mercy?
Haven stands for Healing After Violent Encounters Network. We are forensically trained sexual assault nurses who respond to our hospital for patients for specialized medical care, support, and options for patients who have been victimized by either human trafficking, sexual assault, domestic violence, elder abuse, or any other type of community violence. The only criteria is that a patient wants us involved.
Okay, well, I hope that no one would ever have to go through this, but how about, can you take us through a process of what happens when a person comes into the Mercy ER department and says that they've been sexually assaulted or physically assaulted? How do you help that person?
Well, we will transfer them to a medical treatment room or a private waiting area. Mercy emergency room physician will evaluate their medical concerns, and they will be giving the option of having a Haven nurse involved in their care. If the patient is open to speaking to a Haven nurse, we will come down and speak with them about their care options, medical concerns, and we can assist with that safety planning and how they would like to move forward. We provide, as a courtesy to our sexual assault patients, we provide sexual assault survivors with the option of having evidence collection. So in some cases, we are moving forward with that evidence collection process.
So the Haven program offers secure digital forensic imagery and negative invert filters. Can you explain these and why are they important?
Yes, we are very blessed to be able to offer our patients the opportunity to use the SDFI camera. This camera has the ability to take very high finite resolution images. It is completely mobile, and it allows us to respond to any patient at any point within the main campus at Mercy Medical Center. There are two very unique additional features of this camera, one being the level of security. It meets security requirements beyond HIPAA and the chain of custody. It's military level encryption and completely patient protective. If the patient wants us to do the photo documentation, we'll use this SDFI camera. The pictures are uploaded to a secure computer, military-grade encryption, and the photos are only ever released if subpoenaed, and this is via a secure portal. The second thing that's really important about this camera is the option to add the negative invert filter. This filter option is applied after the picture is downloaded into the system. It does not change the original photo, but it allows us to visually see the injuries that may be difficult to photograph due to either skin pigmentation or tones, or sometimes those fresh injuries haven't really come fully to the surface yet.
Very interesting. So, as an individual who comes to you, they would have to agree to these two. What do we call them? We don't call them tests. We call them monitoring. What do we call them?
It's photo documentation. So the patient has to give us consent for each and every step. Again, it's an a la carte service. So the patient chooses what services they would like to receive and which ones they don't. So as far as with medical assessment, we do all written documentation. Our photographs never replace our written documentation, but we're able to enhance that documentation with the photographs, and that is an option we provide to our patients, and it's solely based on their decision.
Okay. Are they admissible in court?
Yes. That is up to prosecution, and if that moves forward.
Okay.
I'm kind of wondering, I'm trying to put myself in the position of someone that you're describing that would be needing to have photos of that nature taken. Is there a modality for you to help protect that patient from the person who inflicted this injury? I mean, I'm thinking a whole number of different things. You know, you're thinking as a patient, you're thinking fear. If I turn them in, they're going to do it to me again, and it's going to be worse. You know, what do you do for that patient, and how do you communicate? What's a scenario of, okay, you come in and you've been assaulted in some nature, and it's maybe your spouse or boyfriend or girlfriend or whatever. What can you do for that patient?
Well, I think the first step is meeting the patient where they're at, providing that supportive, non-judgmental response to the patient, really listening to their concerns, their needs, safety planning with that patient, and accessing community resources if that's what the patient wants to do. Move in that direction. In that case, I would offer them an advocate from the Domestic Violence Project. We would offer our services and really follow the direction the patient wants to take. You know, one of the riskiest times for a patient, high lethality, risk for death and increased violence is after they report and after they leave that relationship. So understanding those dynamics and really working with that patient to meet those patient needs.
So you're able to basically gather all the resources in the community and direct that person to who might be best suited to help them in their particular situation.
Correct.
Is that oversimplifying? Or?
No, that's a very simple explanation.
Okay.
We don't want to be handing somebody a pamphlet saying, here, call this person for help. We want those resources on site in that emergency department, if that patient chooses that, to really build that bridge with our community resources.
Okay. Are you affiliated with the Crisis Center on 12th Street there?
Yes, they also provide services at our hospital. Yes.
Okay. I'm not sure where we're at.
Well, let's see. We were going to talk about a strangulation assessment. Sounds a little scary to me, but why don't you tell us what Mercy's Haven program has put in place to help healthcare providers and first responders be trained?
Well, yes, about 50% of the patients that we respond to with some type of victimization have been strangled. What's important to know for both patients, first responders, and healthcare providers are that victims may look fine and say that they are fine, but just underneath the skin, there could be internal injury and or delayed complications. Sometimes the onset of visible symptoms can be delayed up to 72 hours. A strangulation assessment is vital for the patient's health and for their safety needs. We currently train all our staff. We have a safe, non-fatal strangulation protocol in place in our emergency department, and we also provide training to EMS, fire departments, police officers, advocates, and all first responders in the area.
All right, so, I'm thinking about sexual assaults and things of that nature that you are talking with. And, there's sexually transmitted diseases in a lot of different modalities, and I'm kind of wondering why...
Sorry, guys.
I'm kind of wondering why... what do you do to protect not only the patient, maybe future exposure, but you as healthcare practitioners with respect to becoming exposed to something that you may not even know is there yet? Do you do testing for the patients to see, have they been exposed to HIV or some other type of sexually transmitted disease, or how does that work?
Well, we offer prophylactic medication to our patients. What that means is after a sexual assault, we do not test for the sexually transmitted infections. What we do is we prophylactically treat. We give the medication in advance. So we will cover with medications, antibiotics for those sexually transmitted infections. That does not require testing in advance. For the HIV prophylaxis, we do give that. That does require an HIV screening test at the beginning, as well as additional lab work to make sure that it's medically safe for the patient to take these medications. And we are currently dispensing those medications from our emergency department. So we do not hand over just a prescription for the patient to go fill later. We're dispensing those from our emergency department.
Okay,
if you have... Sorry.
Excuse me, I got to break in. It is the bottom of the hour. Time for the news, folks. Thanks.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Stay warm this winter and shop the largest auto mall in Northeast Ohio with one click at KempThorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz, there's something for every price range. And KempThorne.com makes shopping easy, fun, and friendly. Less than stellar credit? Never a problem. And we have a huge selection of pre-owns. Kempthorne is a name you know and trust. They've been committed to our community for over 80 years. Shop KempThorne.com.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about Mercy Haven program. We've got a lot more to cover this morning, so let's get back to the show.
Okay, before we had to squeeze the news break in, we were talking about some testing that you can do at the Haven program, and why don't you complete your thought? And I think I have a follow-up question or two about insurance coverage or grant funding or how you guys are empowered to help these patients that really need it.
Yeah, so after a sexual assault, we are able to provide emergency contraception as well as the antibiotics for the sexually transmitted infections. What's important, and I want our viewers to know, is that is not dependent on whether or not you have that evidence collected. If you do have the evidence collection done, those expenses, as far as the STI antibiotics to prevent those infections, as well as the HIV medication, is covered free under the SAFE program through the Attorney General's office. Emergency contraception is not covered under that, so that would be billed to the patient. But I really want viewers to understand that even if you don't have the evidence collected, those medications are still available to you, and we do have resources in place to provide those at a severely reduced cost and free in some cases.
So if a patient comes in based on the programs you just mentioned, hopefully their insurance can help in other ways for things that aren't covered by your program. Is that a fair assumption?
Yeah.
Or?
So our response is 100% free to the patient. There is no charge to have a Haven nurse involved in your care. There's no charge for evidence collection. A lot of what is covered after a sexual assault is tied to having the evidence collected. So if you do have an evidence collection kit completed, the medications will be free. Any testing as far as HIV tests and labs to receive that HIV medication will also be free along with that kit. But we do have a lot of programs in place that if a patient is not choosing to have that evidence collected, we can still provide those medications to them at a severely reduced cost. Anything outside of that evidence collection process and that initial sane response. So if you had to have, say, x-rays done, CAT scans done, an admission, maybe an EKG outside of the HIV prophylaxis, that would be billed to the patient. Suture repairs, any treatments would be billed to the patient.
Okay. So at the commercial break, we were kind of discussing what you see with respect to when patients come in. They might come in right away. They might wait a couple days. Is there any time limitation when a patient can come to Mercy and get treatment in the ER department for this specific issue?
There's not any time limit as far as receiving the medical care and the assessments and documentation. There's no time limits. There are some time limits when we talk about medications that you can be given. So the HIV prophylaxis can only be given within 72 hours after a sexual assault. So that is vital after a sexual assault. If you think that potentially you want the HIV prophylaxis, that's very important to be coming in within 72 hours. Emergency contraception, or also known as like the morning after pill, that can only be provided 72 hours after a sexual assault as well. Evidence collection, biological specimens with the Ohio Department of Health sexual assault kit is 96 hours. So there is some time constraints as far as some of those options, but regarding assessment, medical care, and your STI, sexually transmitted infection prophylaxis for gonorrhea, chlamydia, trich, those type of sexually transmitted infections, there's no time limit on treatment for those.
But on HIV, we're not able to confirm transfer of that disease within 72 hours. Correct? It's just prophylaxis. It's just prophylaxis.
So on a layman's non-medical term, I would compare it to receiving a flu shot. So what we're doing is we're trying to build up your resistance. So if you were exposed to HIV, it makes your body less susceptible to contract that. So we do a baseline HIV screening test to make sure that you're not already HIV positive. And if that test is negative, then we're going to move on to that HIV prophylaxis if the patient chooses to do so.
Okay, gotcha.
We do recommend follow-up testing after, and we give follow-up instructions for patients to how to access that medical care, and we refer them to a physician for that follow-up care as well.
I see. Okay.
What about, I guess I'm thinking about a patient comes in and you, based on your training, you've identified that they have been sexually assaulted or physically assaulted. Are you the staff member required to report that, or how does that work if the patient is ambivalent about being, I don't want to say turned in, but exposed, if you will?
Right. So what's important to know is we never determine whether or not a sexual assault took place or not. That is not a nursing function. We respond to our patients, and we have protocols in place. So no different than if you come to the emergency department and say, I have chest pain, we're going to initiate that protocol. We're going to treat that chest pain. We're going to assess it and move forward down that pathway. The same thing with a sexual assault. If a patient comes in and says that they were sexually assaulted, we're going to offer those support resources, medical care to that patient. So we never determined whether or not that sexual assault took place. We're not involved in any of the investigative process. So along with that, we do, I'm sorry, I lost my train of thought here. What was the second part of that question?
I was just wondering if you were obligated to reporting that
yes.
Basically you had reason to believe.
Yes. So for our patients 18 years or older, they do have several options in reporting to law enforcement. They have the option to fully report to law enforcement, where they want to have law enforcement involvement at the hospital. They want to speak to law enforcement. They're willing to put their name on a kit and have that interaction with law enforcement. They also have the option of not reporting to law enforcement and having us do that. They can have the kit done, they can have the medical exam done, whatever process. They can sign consent for disclosure to law enforcement, and we will do that on their behalf. And then they also have a third option, which is anonymous reporting. They can report with a number and not their name, and assign that number to the kit, and we can turn that over to law enforcement on their behalf. We will not release that information unless it's subpoenaed at a later date. So those options are only available for patients 18 years of older. Anybody under the age of 18, it's automatic report. I have to call Children's Services. I have to call law enforcement. Now, as mandated reporters, healthcare nurses fall underneath that category. We do have to report every sexual assault that comes to the hospital, but that is also patient protective. If a patient does not want that information disclosed, we will simply call that jurisdiction and let them know that a sexual assault took place at this location, this time frame, and we do that without releasing any patient identifiers. But again, that's only for patients 18 years or older.
Nobody older than that. You're not required to report that to law enforcement.
I'm required to report the sexual assault.
Somebody came. Let's say, example: lady comes in, she's been raped. Okay,
Mm-hmm.
She doesn't want to report to anybody. Do you have to do that?
How old is she?
25.
The answer is no regarding the sexual assault. I have to report the sexual assault. I do not have to report that patient's name.
Okay.
So I'm reporting the sexual assault, which fulfills my mandated reporting, but I'm not giving patient identifiers.
Potentially, there's no follow-through on this with the law if the individual doesn't want it to happen, correct?
That is a patient choice.
Yeah, okay. Huh, very interesting.
You mentioned a number of different time ranges and limitations with which you can collect evidence or maybe prevent the spread of a communicable disease. Are there any other guidelines that someone who has been sexually or physically assaulted you might want to share with them with respect to getting treatment and how to, I don't know, maybe is the best question, how to not be afraid to go get treatment and try to get some help and get yourself out of that bad situation?
Well, as far as medical guidelines, I'm a medical personnel, so I'm always going to say the sooner you can come to the hospital for that medical assessment, the better, because we're medically focused, and that's what we're worried about are those medical concerns. Having that exam and make sure medically you're okay and what treatment you need, I think is very important. After assault, important things to think about are, number one, your safety. Find a safe place. Reach out to someone you trust for support. And who can provide you support during this time. Know that you have options. You can come to Mercy Medical Center. Haven Nurse will meet with you. We will discuss your options for you. We will discuss our mandated reporting role. Everything is done up front. You have options. You get to choose which portions you want to give consent for, and that exam is going to be solely focused around your needs and your wishes. Seeking medical attention, again, I think is paramount after an assault. And just considering, if you do want evidence collection done, if you can avoid changing your clothes, bathing, brushing your teeth, anything that would potentially preserve that evidence would be the best possible outcome when we're talking about evidence collection. But just if you have showered, it's been a couple days, still come. Don't let that be a deterrent. We'll walk you through that process and fully disclose what your options are.
I suppose take a break here, JD. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's MEDSHOPRX.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White from the Medicine Center Pharmacies. If you had chickenpox, you are at risk for shingles. Shingrix, the new vaccine for shingles, is now in our pharmacies. Did you already get the other shot? Shingrix is more effective, and you will need to get a 2-shot regimen. Talk to your Medicine Center pharmacist and learn more about this new injection. The Medicine Center pharmacies at Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. See us on MedShopRx.com. Hi, Paul White for the Medicine Center Pharmacy, a locally owned Health Mart pharmacy. Do you know that we partner with Mercy Medical Center to provide low-cost blood screenings in our pharmacies? You can choose from the following screenings: thyroid for $5, lipid profile for $8, total cholesterol for $2, glucose for $2, and A1C for $10. These are the same tests you would receive from your physician. Please give us a call at 330-454-8772 for dates and locations. Come see us at your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you. We keep hearing on the radio that the big chain pharmacies have all kinds of zero copays on Medicare Part D programs, as do we. But our pharmacists using iMedicare software have saved Part D patients lots of dollars by helping select the right Medicare Part D plan during open enrollment. Not all Part D programs cover the same drugs. Our pharmacists make sure that the Medicare Part D enrollees see all the available programs that are the best for them. The Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, 13 pharmacists to serve you. See us on MedShopRx.com. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're talking about sexual assault and the Mercy Haven program with registered nurse and program manager Sarah Schemmel. Let's get back to the last segment of the show. So, what are some of the other agencies that you might work with, that Haven might work with?
Yeah, so we work very closely with Domestic Violence Project and Compass Rape Crisis to provide advocacy, that support, that connection, follow-up counseling, and support within the community. Other agencies we work with are really dependent on whatever patient population we're dealing with. If we're looking at minors and working with a minor patient, then we're going to work with the Children's Network Advocacy Center here in Stark County. We do a lot of collaboration with them for our juvenile patients. We also serve on many collaborations here within the community. Our SART team, which is a sexual assault response team, is a multidisciplinary team: medical, advocacy, law enforcement, prosecution, community legal aid, all those disciplines coming together to provide wraparound services for the patient. We are part of the Homeless Collaborative. We have a lot of great community resources going on here in this county. We serve on the PATHS committee, which is Partners Against Human Trafficking Stark. And so we're really involved with that community aspect and try to meet those needs for the patient as best as possible.
So I think that you're able to place these individuals in a sort of a, let's use the word secret for any other choice that have been assaulted or whatever. Is that true? Or?
Well, again, we don't actually place our patients. That would be a patient decision if they decide to seek those services within our community. And then we do partner with agencies in our community who provide that care, and we'll do that process with the patient. But again, that's completely dependent on the patient.
But it is possible for those people to be immediately placed in some...
Absolutely, if that's what they wish.
Okay. Okay. So we also know that Mercy Medical Center's mission is community education. So how involved are you in Haven in community and professional education?
We're very involved in the community and professional education. Within our community, we offer speaking and education resources. So like I recently mentioned, we've been partnering with our fire departments to provide training for EMS staff regarding identifying victimization within the community, what that medical response is, and best serving those at-risk populations. We also send our nurses to training throughout the state of Ohio and outside of Ohio for that specialized continuing education. We partner with our prosecution for expert witness testimony preparation. So we're really heavily involved in the community. We do a lot of health fairs, a lot of speaking engagements at colleges to help identify at-risk populations and what that response is. How can you get help? Where can you go? And what options and services are available to you at Mercy Medical Center?
It seems like such an involved scenario. You know what I'm saying? Someone comes to you, I've been assaulted, I've been whatever. And from our discussion this morning, it almost sounds, I'm not trying to criticize the program, but it's just, and I know the legal ramifications of this scenario is very tough. And, you know, gravitating through all of these things for a patient, how many of them just, I can't do this, you know?
Well, again, that is a patient choice. So no different than if you go to the hospital and they explain a procedure to you. Maybe it's a blood draw. Maybe they think it's best that you have a catheter placed, you know, in your bladder to relieve the urine. You have the right to say no. It's your body. We're not in the business of re-victimizing anybody. They have options. They have choices. And we give them the education behind whether it's what they're consenting to or whether they're declining a service. We're going to give them that full education and options. And then it is their choice in those situations.
I had occasion to sit through a trial as a potential juror. And in the beginning, in the interview process of potential jurors, I thought, and this was a case sort of related to what we're talking about this morning, you know, and I had, I couldn't believe the things that the defendant was told about the people that would be prospective jurors. And that would be something, if I'm looking at that as a man or a woman, after what I saw, that to me would be, I'm not going to do this. And maybe after the program I'll tell you what I saw, but I thought, and the question I asked before this was, how frustrated do many of these people get with the system after they report an assault or rape or whatever?
Well, I think it's going to vary depending on each patient's experience, their perceptions, and each individual case. I think the most important thing that we can do is treat people with kindness and dignity.
And that is what I saw.
And you know, that is a little bit of kindness goes a long way in somebody's healing process, meeting them where they're at and supporting their choices. Justice looks different to each and every patient. Okay. So, you know, what does justice look like to them? What do they want out of their medical care and the people that are supporting them? And just, again, meeting that patient and their needs where they're at that moment.
I'm sure there's a lot of fear, too. I mean, it would certainly take a lot of self-directed focus to face something that is a very terrible experience. And whether it be in private or public or even in coming into your ER, I guess I would encourage people who need help to seek advice and education like you're offering at your program. And it sounds like it's one step at a time. And keep yourself safe and be well. And I'm sure you have comments you want to part on. We've got just a little bit of time.
We've got a minute and 33 seconds.
Well, I just want to say thank you for having me here today. If anyone has any questions regarding our program, how to access us, how to have us come out and provide community education, I'll give you our administrative phone number. Our office is 330-489-1000, extension 2170. If you need medical care, immediate medical assistance, need to access a Haven nurse or SANE services, you can easily do that by going to our emergency department, and they will contact us and we will be there to respond to you. We have nurses in-house 24/7, and we also have an on-call system. So our whole goal is to provide that 24/7 response.
Okay. Thank you very much, Sarah Schemmel. We are out of here. Registered nurse and manager of the Mercy Haven program. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, Chemthorne Motors, and of course our technical producer, J.D. DeAngelis. Tune in next week to hear our guest, Stacy Doherty, staff nurse, endoscopy from Altman Hospital, talk with us about colorectal cancer. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy, right here every Friday morning at 9 on News Talk 1480 WHBC.
The preceding program was sponsored by the Medicine Center Pharmacies.